Hi, I'm Lawrence Bergstrom, osteopath and non-surgical spinal disc decompression specialist. Why does your osteopath have a stethoscope in their consulting room? We'll give you 4 reasons. Number 1, to listen to your heart. Okay, so you'll come to the osteopath typically because you have spinal pain or maybe joint pain. So you might be thinking, well, why does the osteopath need one of these? One of the key things that we do is we assess your general health as well. We don't run to the assumption that because you have back pain, that it is your back that's causing you pain. It could be an underlying organ system. So one of the things we'll do is we'll listen to your heart, and we're listening for things like regular heart sounds, irregular heart sounds, irregular heart sounds. So that's a simple thing that we can do, okay? Because sometimes, and most people are aware of what we call the radiating pain from a heart attack, where somebody might have pain in their jaw, in their neck, radiating down an arm. It's possible that they could even have some radiating pain into their mid-back or of course their chest. So one of the things we're going to do, we're going to listen to your heart with our stethoscope. Okay. Now, a second reason, lungs, lung function, breathing, extremely important. Now, it's possible for the pleura, the outer covering of your lungs, to radiate pain into your spine. So you can have back pain. And again, the assumption could be made, well, it's back pain. Well, the pain may be felt in your back, but it may not be that it is your spine that's causing you the pain. Okay, so one of the things we'll do, we'll listen to your lungs, and we're listening for several things. We're listening, are they clear? Does one sound different to the other? Do you have rattles? Do you have wheezes in there? Asthma, chronic obstructive pulmonary disease, these kinds of things that will give particular sounds, or even something like a pneumothorax. Somebody might have had a heavy tackle on a rugby field, or fallen heavily from a bicycle, or had a skateboard accident, and they're not feeling that good, and over the course of a couple of days I'm starting to feel quite short of breath, but maybe it's just because I've bruised something. Well, I've seen a patient that had a skateboarding accident, and a young, teenager, 17, 18, and in the end he came to see me. His parents recommended that he come and see me, and he had some bruising around his ribs, and he thought, well, it's just because I've had a skateboarding accident, but in actual fact, he had a pneumothorax. So these things can happen. So it's basically where one lung is collapsing, and that's a medical emergency. So this is a very, very useful tool, okay? Here's one that you might not expect. We can listen to the carotid arteries in your neck. Now, why would we do that as osteopaths? Well, if we're going to mobilize your neck, if we're going to do any soft tissue work or manipulations, or we're going to do some non-surgical spinal decompression, if we suspect that there might be a problem, possibly something like atherosclerosis, which is a furring up of the artery, that's very important. Or if we suspect there might be some form of blockage in your carotid artery, we're going to be sending you back to the doctor, or we're going to be sending you off to a consultant. We're certainly going to want either CT scan or MRI. So what we can do, we can actually listen to the arteries in your neck. And the kind of thing we're listening for is abnormality in sound. So one side we've got a whooshing sound with something that's causing friction, really. So if there's an increasing blockage in your carotid artery, and as blood's pumping past it is causing a whoosh, whoosh sound, that could be of concern to us. So we may well be getting you back to your doctor very quickly for that, okay? So, fourth one. This one will surprise you. We can listen to your jaw function. Now, at this point, you'll be thinking, what? So, if you've got a problem with your jaw, we can listen to it. Now, the jaw is a fibrocartilage joint. It's designed to slide forwards and up and down and side to side, and there are fibrocartilage discs in this joint. Now, if somebody's got a lot of pain, we can actually listen to the function of your jaw. So it could be that this side there's a lot of creaking, crunching, what we call crepitus, which is like a crackling sensation. So we can listen to that, and then we can compare the two sides. Then it might be that we send you for medical imaging, MRI or X-ray of your jaw, which will help us in narrowing to a diagnosis and then making sure you get the correct treatment. So there you are. There's 4 key reasons why we have one of these in our office. So it's not just a medical prop. We're trained to use them, and we do use them. Okay, so hope this has been of interest to you. Thanks for watching.